I'm going to let you talk in a second about how you manifested $2,000 out of nowhere.
I even put makeup on today, and I normally don't.
Look at you.
You got me.
You got your self care routine down pat now, huh?
CEO style.
Miss CEO, CEO.
I feel more confident actually in this than I did thinking about being a consultant just for dietitians. I actually feel, again, more confident that I can walk into a boardroom and have this discussion with stakeholders.
I'm here with Miss Cindy, guys. We're back with another amazing interview with another entrepreneur. You're in Dallas, right, Cindy?
Mhm.
All right. So Cindy and I have been working together for a couple of weeks. She has made so much progress. I told you on the first call, I already knew you were going to be one of my best students because you're willing to do the work. You're willing to think positive and just make it happen regardless. You have been controlling your reality like never before. Will you please just tell the audience a little bit about what it's been like for us to work together?
Yeah. So I went into it wanting to work in my field and kind of change things up for I'm a dietitian by trade. So I decided that I wanted to work on consulting, really kind of grow the dietetics world. We're at our lowest rate of hiring. We're unable to find dietitians to hire. Our internship rates are very low. People are no longer interested in our field, but it's all because of pay or the work environment. So it's not that people do not like nutrition. It's just they are not willing to interact with the current situation, what we're at. And so, I sat with that for some time. We worked on a plan. I was going to, create some exposure for myself, get on LinkedIn, do some things. And, I went through and I realized that, again, we all have the same sentiment. There are dietitians out there like me wanting to do, having to go private or, do consulting work because they do not feel that they are being impactful in their current roles, whether that's at a regular hospital, in the wellness realm, things like that. And I realized that what I was doing was too small. I was keeping myself too small. I was staying within my little bubble of nutrition and thinking that you know that dietitians aren't so well respected in that business realm where I could do more or I could be bigger. I could be the CEO or I could be that consultant that could change your whole healthcare system, not just the nutrition department. Um, Realizing that I already have all the knowledge and I just need to tweak some things and I can work on those things. But it was allowing my mindset to go somewhere where I felt fear. I felt safe being in my little nutrition realm, but being willing to face the fear of I can do more. And then once I sat with that, I realized I can. I already have all of the knowledge. I already have all of the tools. I already have all of the education. The only thing that was limiting me was myself willing to acknowledge that I am better equipped than even some of the consultants that are out there already, just off of my experience, not even my education. Um, and so, yeah, I feel more confident actually in this than I did thinking about being a consultant just for dietitians. I actually feel, again, more confident that I can walk into a boardroom and have this discussion with stakeholders more so than just about nutrition, because this is actually more impactful to the healthcare system than what I was wanting to do initially, which was just nutrition. So I can sit here and show them how impactful overall we can be if we make some changes. And then obviously, I know that that would impact nutrition, that would affect dietitians in a positive way. And so we really just need to be confident that our skills can actually be received um, by people we deem, in a higher level than us. So yeah, it was realizing and facing my limitation, facing the discomfort that I felt when I thought about wanting to grow myself, and realizing now this whole time, like I probably could have already done that had I just, been upfront with how I felt about it. So I'm really looking forward to, yeah, putting myself out there and seeing what feedback I get. Um, you know, it's going to be a great experience. I'm really looking forward to it. I'm ready to again walk into a healthcare system and say, "This is what I can do for you."
Yeah. I'm going to let you talk in a second about how you manifested $2,000 out of nowhere. Um, but first, let me say from consultant to consultant, what we don't realize the impact that we do have on companies when we come in and help them make difficult decisions or solve difficult problems, right? Solutions that they're so closed-minded they can never dream of. Actually being able to make money and help people at the same time. Do what's best for people, the employees and the customers at the same time. So, on behalf of the world, I truly appreciate everything you're doing for the healthcare system. I feel like you've been more impactful than you even know. Just because your face isn't on billboards and your name isn't in the news doesn't mean that you're not making just as much of an impact. Okay. So, before we talk about your manifestation, tell me what were your three certifications that you have, or your three degrees?
Uh, so I have a bachelor's in science in nutrition and food service. I have a master's in health promotion with a background in sports nutrition. And then I have a master's in dietetics and food service.
Okay. So you were telling me how you were working with a client where you helped them find an extra $2 million in profit that they were leaving on the table, right? So let's say there's a CEO of a hospital or somewhere. Who's your ideal client and how could you help them? Like, what's an example of a way you could help them improve their business?
I would say that my ideal client would be a mid-level, what we call a mid-level community hospital. So typically it's not like your medical center, but it's your community extension of that medical center. So usually their hospital is about 2 to 300 bed size. So they usually have acute care, which is, when you go into the emergency room, you stay for a few days. And then they also have what we call outpatient services. So, your follow up appointments, therapy, rehab, those kinds of things are conjoined. So they do inpatient and outpatient because one drives a little bit more revenue than the other.
Mm-hmm.
So, kind of I could be able to help the client see where that missing revenue is, um, whether it's on the inpatient side of the house, and then how do you continue that out into the outpatient sector? The goal is to keep the patient with you through their whole healing journey, right? So that would mean that you need to provide services for when they are out of the hospital. Again, whether that's they have to stay at one of your internal your inpatient rehab facilities, or do they need to, one of your sister sites, whatever. But yes, but looking at basically what I did is from the dietitian's role in the facility is, even though that area is very small in FTE count, usually you only have 2 to 3 dietitians working, and then sometimes you'll have one in outpatient. And then you have for nursing, you have one nurse to every 4 to 5 patients, right? And so, yes, your nurses are very impactful. They do, things, but they are not a revenue driver like the dietitian could be. The dietitian actually legally can diagnose. They can do um, some therapies and things like that. And so, even though a bulk of your budget isn't going to the dietitian, right? It's going into the other departments because they're so much larger. But realizing that they do drive revenue, and so maybe increasing their FTE count just by one. What can you do and what kind of outreach can they have? Because, yes, you have a nurse that's seeing 5 patients today. They're doing that for 12 hours and they're caring for that patient. This other dietitian is seeing 20 to 25 people a day.
Mm.
So, what are they able to do with those 25 people? And they go to different areas of the facility, so they are not limited like some of your other interdisciplines are.
Yeah.
Even, your therapies are kind of the other way too. You kind of look at the therapies the same way. But yeah, so it looking in the maybe in the crevices a little bit better,
Hmm.
to see what's just hidden in plain sight. We're always quick to say, well, patient engagement, getting that, like I said, getting that patient to return for their follow-up visit so that you can bill insurance. Okay, but again, there are other avenues that don't require even getting reimbursement from an insurance, so yeah, so that was I would like to work with someone who is willing to kind of think outside of the box. Um, like I said, not just doing your usual things, or do we just, start increasing our educational opportunities, things like that. I think there are some really easy options. We just have to be willing to look for them. And like I said, at a lower cost to the client, versus them having to put forth a lot of money, whether it's into more marketing or something like that. And just
Yeah.
seeing what's already there that they can just use.
Right. You already got all the paintbrushes. You keep
Yeah.
using black and pink. We could actually mix white and red and still get pink.
Hmm. Yeah.
Yeah. I think people don't they underestimate the impact that consultants can have. And just think, oh, well, you're just sitting in meetings and all day, just sitting in meetings. No, my real work happens after I've taken all my notes and have gone made a masterpiece that
Hmm.
you couldn't see all along, right? So
Yeah.
again, kudos to you. You're doing some amazing things. All right, so let's talk about this manifestation. So on our first call, I didn't even tell you what I charge. I was like, I'm gonna let you name the price, right? And you were like, well, I know you're worth like $2,000. And I was like, well, I wasn't gonna say that much, but okay. I mean, I do get that much, but like because I met you on TikTok, I just was trying to give everyone the chance to start off with what they were comfortable paying so that they could focus on making progress and not be focused on, oh my god, how am I going to pay her this money, and so at first that's how you felt. You were like, well, you limited yourself, right? So talk a little bit about that, how you overcame
Yeah. So I definitely I sat there and I thought with it, and um I was, I guess I went into it thinking, okay, I have to get this $2,000. And it wasn't because, yes, I knew what I was worth. I am worth that $2,000, right? I'm investing those $2,000 into myself. I know that. And that's not the part I had a problem with. Some people are like, oh, it's a problem with my worth. No, that wasn't my problem. My problem was I don't, as a lowly dietitian, how am I going to get $2,000? That's where I kept sitting with that. And I was just like, and that was that limiting belief. And I was like, and so I kept, I just sat with it and I said, no, it's going to happen. It doesn't matter if I'm a dietitian or not. It's going to happen, because that is the power that I have. I'm not a dietitian. I'm way more than that. And so, okay, so I just said, okay, I'm gonna on our next call, I'm gonna say I got a $2,000. I have it. Here it is. That was what I kept telling myself. And then a few days later, I got $500. And I was like, okay, this is good. Like I've never even done that before.
it.
If I didn't work for my money, I had not received any. I didn't do anything for this money. This money showed up for me. I just got a text message that I got a Zelle for, and so I was like, okay. And then for a second, I was like, well, at least I can tell her I did that. And I was like, but that's not $2,000.
Mm.
And so I was like, no, it's still going to be $2,000. This is just a part of that. And so I still thought about it. And it got closer to our meeting, and I was like, man, I was getting nervous. And I was like, no, I got this $2,000. And then last night, I got the remaining 1,500. It just showed up for me. And so, yeah, that was huge for me because, yeah, up until that point, if I didn't make the money for myself, I never got it. And so, yeah, it was huge. And I get to tell you that I made $2,000.
What I'm even more excited about is the fact that on our call today, we've already uncovered so many ways where you could be making 100 grand a month or 500K a year.
Yeah.
So this is only the beginning for us. I'm just so excited. You have blown my mind even more than I expected. I mean, I should have expected it. I don't know why I would have ever doubted us. But I'm super excited to see what we have to come. You're already on a roll. Truly appreciate you talking with our audience today and sharing your story. I have no doubt that people are going to be reaching out to you very soon to work with you, to get knowledge from you, to pay you what you know you're worth beyond what you even think you're worth. You also have a daughter
I'm
too.
ready. Yes.
How important is this for your daughter? You just not giving up.
I'm going to show her that you can do things, I had degrees and I thought that made me that was going to do good things for me. My degrees are going to take me places. I'm going to make so much money with these degrees. And now I can tell her that, you know, I had those degrees and, that they served me really well, but my mind is going to take me so much further, and that's what I want her to learn is it's you can get the degrees, they make you confident, they open doors, but you are the person that makes them grow.
So beautiful. We both have kids, so we share that. That's all the mom wants.
Yeah. Yeah, Mike, she's going to do so well. And I look forward to showing her. Yeah. It's going to be great. And failure is not an option because it's not going to be.
Yeah,
It's only redirection if I allow it. But
love that. Thank you so much,
yeah.
Cindy, for opening up to us today. And we're gonna chat soon. So
Yes, I look forward to it.